So the anterior deltoid, the origin is on the clavicle, and the clavicle, and it goes to the deltoid tuberosity, and then the middle deltoid is on the acromion process, and it's also at the deltoid tuberosity of the humerus, and then the posterior is on the spine of the scapula in the back, and it goes to the glenoid tuberosity. And then for the anterior, the line of pull goes from the deltoid tuberosity to the clavicle, and then it would cause, the line of pull would cause flexion, flexion, and then here, flex your arm, and then it would also pull in for medial rotation, or internal rotation, and what's the last one? And oh, horizontal abduction. So if it pulls here, it's gonna go that way. And then the middle fibers, the line of pull would be this way, and then it would do abduction like that. And then the posterior would do extension like that, or external rotation like that, or horizontal abduction, so like that. Cool. And then for palpations of the deltoid, find the deltoid tuberosity, the acromion process, and then palpate cranial nerve. Be sure to explore anterior and posterior. Okay, here. Okay, and then when I found the landmarks, and then to palpate as this is moving, feel that. Okay, abduct, abduct. Thank you. And back down, pull. And then for the anterior, do that again, abduction. Or let's try it with flexion. Okay, flex, flex, flex. Yeah, I feel the muscle palpating. And then for the anterior, extend, down, down, down. And then a little bit more. There you go. Cool. And those are the palpations. Okay, so the latissimus dorsi, the origin is at the last six vertebrae of the thoracic, the last six thoracic vertebrae, the last three or four ribs, the thumb thoracolumbar fascia, which is here around this area in the back, and the posterior iliatic crest, which is here on the side of the hip. And then the insertion is on the intertubercular groove, which is in between the greater tubercle and the lesser tubercle, so it should be connecting around this area. And then the line of pull is from the arm down to towards the back. And then the line of pull, it would create these actions. Let's see. External rotation?
Internal rotation.
Internal rotation.
Extension.
Internal rotation, which is downward. Extension, which is back. And adduction, which is down, like that. Okay? And then for palpating, okay, so move against my hand. Yeah, and I feel the muscle right here. Okay, loosen up again. Try it again. Yeah, I feel it contracting over here. Okay, so teres major is also in this back, in the back. It starts at the inferior angle of the scapula, and then inferior angle of the scapula, and then attaches to the lesser tubercle of the humerus, and then the line of pull is going to be from the humerus down to the origin this way, and then it's going to help with internal rotation, adduction, and extension. Cool. And then to palpate, so medial, where you find the border, medial to the latissimus dorsi attached to the lateral border of the teres major. You will find the teres major. Okay, so I have a feel on your back. Okay, loosen up your arm, please. Oh, no, never mind. Push back against my hand. Okay, loosen up again. Okay. Again. Okay, one more time. Yeah, I feel it in your back. Like, more in the back. Cool. Okay, so let's do that again. The supraspinatus is here at the supraspinatus fossa on the superior side of the scapula, and then the insertion is at the greater tubercle. So the line of pull is from the greater tubercle inward that way, and the actions are abduction of the scapula. So it would go up like that. Okay, and then for palpations, for the infraspinatus, okay, so I want you to put your arm sideways like this, okay? So, circulate, okay, again, loosen it up again, and again, boom, there it is, in the supraspinatus. And then the infraspinatus is on the infraglenoid fossa, which is inferior part of the scapula, and then it connects to the greater tubercle as well, and the line of pull is going that way towards the midline of the back, and the actions are adduction and external rotation. And then for palpations, let's see.
You said you can't, right?
No, for this one we can. The infra, it's okay, but the subscapularis is under the bone. Okay, and then just raise your arm like this, like raise your elbow. Raise your elbow. No, not like that. Like this. You feel that? Okay. Yeah. Okay, and down again. All the way down. And up. Yeah. Down. And one more time. And you're good. Cool. Alright, sick. Anyways, okay, so the teres minor, it's on the lateral border, which is on the bottom, 2/3, and it attaches at the greater tubercle. The line of pull is going to be from the greater tubercle to the lateral border like this, and then the actions are adduction and external rotation. And then for palpating, I'm going to externally rotate. Okay, externally rotate, please. I can feel with my thumb that it's flexing right here. Yeah. The subscapularis is on the back, and it's deeper under the. It's in the subscapular fossa, which is deep in the scapula, and the attachment point is the lesser tubercle, and it would be pulling inside, but it's a deep muscle, so I can't palpate.